When we see a patient with diffuse large B-cell lymphoma, in general, most patients get a baseline PET CT. That's part of our staging evaluation. And everybody does this a little bit differently, but most of us will get an interim PET scan after 2 to 3 cycles. And we get that specifically to assess their disease response. By 2 to 3 cycles, we don't necessarily expect all of the disease to go away, but we should see a significant improvement in disease burden. And for those patients where you don't see that significant improvement, we know that they're probably resistant to chemotherapy. And in the era of CAR T-cell therapy, we now want to move forward and get those patients to that next line treatment. So I generally get an interim scan. And then to document remission, we get an end of treatment scan. And that end of treatment scan, we are looking for a complete remission by PET CT in particular. And if we don't have that, I'm actually going to go biopsy the area of residual disease to determine, is it active lymphoma or just sort of, uptake that doesn't correlate with disease. And this is important to do because we know with aggressive diseases like DLBCL, cure is the goal. And so if we don't have them in a complete remission, we haven't done good enough. Now, what's exciting is novel ways to assess patients with diffuse large B-cell lymphoma. Lots of data coming out for new assays, such as circulating tumor DNA, which might be a better methodology that gives us an in-depth sort of minimal residual disease way of assessing response. And so some of those are being developed for clinical evaluation. And so again, more to come. But in the future, we might be using blood assays in addition to imaging to really measure the depth of response for our DLBCL patients.